Thank you for listening to Depictions Media Radio.
Good morning, everybody. This is Margaret Harris welcoming you to this WHO Palais press conference on a really, really important subject that touches not just the people affected, but the families and the communities. This is a progress report on the action plan on dementia. I can see that most of you are here, so I think it's a good time to start. We've got a very large contingent of people joining. So please get your hands up early so I can make sure that I get all your questions in. We will start. We've got two specialists in this area who really are highly expert. We've got Dr. Catherine Seho, who's developed the report essentially, and she will give you an overview initially. We also have Dr. Taran Dua, whom I think many of you already know, both from our mental health and substance use department. So without further ado, I'll hand over to Dr. Sia. Would you like to tell us all about the report?
Thank you, Margaret. Absolutely. I'm very pleased to be here this morning to talk about the Global Status Report on the public health response to dementia. With currently over 55 million people living with dementia worldwide, dementia truly is a global public health concern, like Margaret has said, and not just in high-income countries. In fact, over 60% of people with dementia live in low and middle-income countries. Due to population aging, we expect the number of people with dementia to increase to 139 million by 2050. To respond to this global challenge, WHO member states adopted the Global Action Plan on the public health response to dementia in 2017. The action plan outlines key activities across 7 strategic areas and formulated global targets for us to reach by 2025. Now we're halfway into the action plan, and the report that we're launching today takes stock of the progress that we've made so far and outlines areas where we do need to increase efforts in order to reach the 2025 dementia targets. The report includes, for example, new estimates on dementia burden and costs globally. It uses data submitted by 62 member states to the Global Dementia Observatory. Now, while these 62 countries only represent about a third of WHO member states, together they cover 3/4 of the population above 60. Now, what does the report tell us? It shows that in some areas we are making important progress, but overall it highlights that we're far from reaching the 2025 targets as yet. So, for example, we see that only 26% of WHO member states currently have a dementia policy or a plan. And in many cases, these plans are about to expire or have expired already. So that leaves far too many countries basically without a comprehensive policy response. We also need to strengthen the health and the social care system in countries to ensure that there is universal access to dementia diagnosis, but also to treatment and care. And we especially need to reduce the gap that exists between high income and low and middle income countries and between urban and rural areas. Informal care constitutes roughly 50% of the global care costs, and 70% of that is actually borne by women. Carer programs and services must be developed and funded to reduce that burden on informal caregiving and support carers in this important task. The report also shows that everywhere in the world, countries' capacity needs to be increased to maintain health information systems for dementia and monitor core indicators so that they will guide evidence-based actions. Finally, dementia research needs to be better coordinated and particularly involve low and middle income countries. In conclusion, an important message that the report sends is that we do need to do better in involving people with dementia and their carers in policy development, in awareness raising and risk reduction efforts, but also in care planning and importantly in research. Far too often their voices are not heard yet, and this is something that we need to change. Thank you very much.
Thank you so much, Dr. Sia. So we'll go right into questions because I know you've got a lot and I can see a lot of hands up already. The first one is Agnes Pedrero from AFP. Agnes, could you unmute yourself and ask your question?
Yes, good morning, everybody. Thank you for taking my question. First, I have a question on the figures. I have a look at the figures you WHO gave us in, I think it was 2 years ago or 3 years ago. It was before the pandemic. And WHO was expecting 152 million of people with dementia in 2050. And so now the figure you are giving us is lower. So I was wondering if that's a good news and if you could explain why the figure has decreased. And then a question, I wanted to know if you could explain us why there is this very low percentage of countries having dementia policy. Is it a lack of interest? What are your conclusions on that matter? Thank you.
Okay, thank you very much. Two very important and good questions. First of all, on the decrease of figures, you're right. Compared to earlier estimates, the projection for 2050 have gone down a bit. This is mainly due because the model now, or we've fed into additional studies, so the source data is different. More research has been done. And also the modeling assumptions, statistically, some have changed. Is this a good news? We should consider these numbers or projections with caution. First of all, because they are projections, so they're never 100% accurate. As longer in the future we go, the more uncertainty there may be. It's also important to remember or keep in mind that our statistical models are only as good as the data and the information that we feed into. And one big problem that we see in the area of epidemiological research is that for too many countries still, we don't have reliable data on dementia prevalence. So the models make assumptions. At the current time, they make the best assumptions that we can do, but we do need more information to get better and importantly feed in information for areas and countries where there is no information available at the moment and where we do need to impute information. Lastly, one thing that our models at the moment can't reflect, but what needs to be reflected is the potential change of risk factors in the population. So our dementia prevalence over time may change depending on what happens to risk factors for dementia. So I think in summary, there is a certain amount of uncertainty. The models right now are as good as they can be, but I think it's too early to say that these are really sending a clear positive message that numbers are going down. It's simply too early for that. And on your second question about the number of policy or the low number of countries that have dementia policies is To a certain extent, yes, there is a lower interest in, or awareness, I would say, in the importance of dementia. We also need to be realistic and see that dementia competes with a lot of other public health problems. So it might not be realistic for every country to develop a standalone dementia plan. What the report shows us, though, is that if a country does not have the resources to develop a standalone dementia policy, what they can do is integrate it into other existing policies, such as for non-communicable diseases, for aging strategies. And by that, you can actually use synergies that are available at country level and still make sure that people with dementia do receive the care and the attention that they require. So I think in summary, we do need more awareness at government level to formulate dementia policy responses. It does not have to be as a standalone plan. It can be integrated into other areas.
Thank you very much for that comprehensive answer. Just checking with Taryn. Dr. Dewar, do you have anything you want to add, or you're okay there? Looks like you're okay. Yeah.
Can you hear me?
Yes, I can.
Yes, Margaret. No, just to add, but that if, as we are saying, there are 55 million people living with dementia, so we need to look at the number of people and their families that are currently impacted. Going on to 2050, 139 or 150 million, it's still a large number of population that's going to be impacted. And what we need to have is a sense of preparedness in countries to deal with that increasing burden. And that's not apparent with 26% of countries having those policies. So what we need is accelerated action, because otherwise the countries will not simply have the systems in place to help these people with dementia and their families. So I think that's what the urgency that's we want to convey through this report today. Thank you, Margaret.
Thank you very much, Dr. Dewar. Next in the queue is Peter Kenny. Peter, can you unmute yourself and ask your question?
Yeah, thanks for taking my question, Margaret. I would just like to know some very basic answers. Dementia is often considered to be a more elderly person's disease. So at what age is it known to start? Because I hear more and more of people relatively young who have dementia. And the other question I would like to ask is, can dementia be cured? If you get dementia, is it there for life? So is it just to be treated or ameliorated, or is there a cure for it? Can it be stopped or reversed? Thank you very much.
Dementia mainly affects older people, but it is absolutely not a normal or inevitable part of biological aging. That's a message that we do send or want to send very strongly. It is true, though, that it can also happen in people who are younger than 65. In that case, we speak of young onset dementia, and that proportion is roughly about 10% of all the dementia cases. So it is not only a problem of the older population. On the question of whether or not dementia can be cured, at this stage, we do not have a cure for dementia yet. And we should also keep in mind that dementia it's an umbrella term. So it has over 100 different diseases that can cause dementia. So finding a cure for every single one of them will be challenging. There's a lot of research going on towards finding a cure at the moment. With recent partly successes in disease-modifying drugs, but we're far from being able to cure dementia. So at this stage, and I think that's why it's so important to prepare health and social care systems, we do need to provide care and support to enable people who have dementia to live as independently as possible, and with the right amount of support that is truly possible. Tarun, anything to add?
Just to add that while dementia, we don't have a cure yet, it can be prevented. And I think that's an important public health message the report is giving. For example, healthy diet, looking at the risk factors, which are the same risk factors for non-communicable diseases such as tobacco use or harmful use of alcohol, managing conditions like hypertension, diabetes, depression, social isolation. These are the things that we can do to promote our brain health and decrease the cognitive decline and the risk for dementia. And these are something that can be started at a younger age. So I think the message to countries and message to everybody is to take care of what you think about is good for your heart is also good for your brain. And we should incorporate those healthy lifestyles, decrease those risk factors, and thus we can decrease the risk of having dementia.
Thank you so much for those great answers. The next question is, the next person in the queue is Jan Heberman. Jan, can you unmute yourself and go ahead with your question?
I think I got unmuted. It's Christiana here.
Oh, Christiana, sorry. In fact, you were next. And I thought Jan was, but anyway, go ahead, Christian. You're next in the queue. Go ahead.
Thank you very much. I was going to ask about the risk factors. If I know dementia from cases in my own family. I did not have the impression that this was a question of bad diet or tobacco use. So I would like for you to delve into this a little bit more. And I did not quite understand, Katrin, just before saying how many of the dementia cases are actually caused by old age or are old age people. Maybe you could just clarify that. Thank you very much.
Okay, let me start with the risk factors because it kind of goes into, or it interrelates with age. So what we know is that age is the single most or the strongest risk factor for developing dementia. And that means that we do see stark increases in dementia prevalence after the age of 65. So within every 5-year age bracket, the prevalence of dementia increases rapidly. So that's what we mean with age is the strongest risk factor for dementia. Other risk factors, and here now we're talking about modifiable risk factors, contribute overall to about 40% of dementia cases. That means that potentially 40% of dementia could be prevented if we were to eliminate all these risk factors. That still leaves us with 60% unaccounted for, and a large proportion of that is age. But whenever we talk about dementia prevention and risk reduction, we're focusing on the factors that we can modify. And here, important factors to consider are, and it starts very early on with school education or access to education, because that builds brain reserve, basically more brain cells to compensate later on. It then moves into things like Tarun had mentioned, cardiovascular risk factors such as hypertension, diabetes, being overweight. It also includes things like depression and social isolation that do correlate with dementia. Other more recent evidence that we see is related to traumatic brain injury and head injuries, and that's why we say it's so important to protect our brains and heads from injury and impact through wearing helmets, for example, and correcting hearing loss, for example. So there are a range of factors that go beyond the what is good for your health message. What is good for your heart is good for your brain message. But the big opportunity that we see here is that if we combine dementia risk reduction with NCD risk reduction efforts, we're building strong synergies and having potentially a huge impact. Hope that answers the question.
So, Tarun, do you have anything to add?
No, Margaret, I think Catherine has covered it well. Just to say that when we are thinking about these programs or aware, the risk reduction messages, they need to be combined with as part of overall awareness and understanding. Because many countries and many, if we look at general public, they're not aware of what is the risk factor for dementia, what can be done about it. And also there is stigmatization that is associated with it, that, dementia is a normal part of aging, nothing can be done about it. And I think that's a message, that's a myth that we want to break from WHO as we come out with this report. The second point that I just wanted to add is that this needs to be an integral part of the prevention from the primary healthcare system as part of the universal health coverage. So these are very integral strategies that can be delivered by a community health worker, by all of the health workforce. The third thing that I just wanted to use this opportunity to emphasize, that what we also want is that as we have these messages for prevention of dementia and care for dementia, we want to have a society that is dementia inclusive. So enhancing friendliness around dementia, training our police workforce, our communities, our banks, because it's about providing support for people with dementia and their carers. So many things can be done. They are not very expensive. What is required is that everybody, including the governments, they prioritize dementia action.
Thank you so much for that message. Dementia is not inevitable. Lisa Schlein, you're next on the queue, and I see Jan is back in the queue, and you're after Lisa. So Lisa, please unmute yourself and go ahead.
Okay, the signal to unmute came a little slowly. Somebody must be having mental problems, maybe. No, about this issue of prevention, I must say I'm a bit gobsmacked by your answer, because there are so many different forms of dementia, I believe. And, I don't think I've ever heard that it can be prevented, maybe reduced or stalled in certain ways. I mean, because certain diseases are preventable. I don't know. Are you saying that that dementia really is preventable? Yeah, I'd like an elaboration upon that, because I'm quite confused. And of course, when you come to something like Alzheimer's, I don't know whether you categorize this as dementia or not, or this may be one of the root causes of various forms of dementia. That seems to be a very difficult disease to prevent. Okay, but now the original question that I had has to do with your action plan, whether maybe it's the cost of implementing action plans, which is a problem that very few countries are doing this. And from your press release, you seem to indicate that it's mainly the European countries that have these plans. And when you come to the developing countries, they don't have it. And developing countries don't have the resources for all kinds of diseases. And perhaps infectious diseases are a priority over something like dementia. Sorry, just one other aspect about this is that I'm wondering whether cultural barriers might have something to do with the lack of awareness or lack of wanting to recognize dementia because it is a mental disease and there is a lot of stigmatization in many societies about people who have mental diseases, superstition, and so forth, so that perhaps this is something that people in some of the poorer societies, tribal societies, do not wish to recognize. Thank you.
Absolutely. Let me start coming back to the prevention bit. So when we say up to 40% of dementia can potentially be prevented, this is a hypothetical a scenario that because it means that of the risk factors that have been identified, they would need to be eliminated completely in order for those case reductions to occur. So in that sense, the term prevention is, I agree, might be misleading. So that's why we often use the term risk reduction. So there are many things that we can do to reduce our risk. Does that mean that if we do all of these things, we will never have dementia? No, we don't know, but we are reducing our chances of getting dementia. So I hope that that clarifies that. And on your second question about the cost for implementing a policy and the divide that we see also by region, I agree. It does. Developing a dementia plan and then funding its implementation does come with a price tag. That's why the Global Action Plan actually recommended or set the target not just to develop dementia standalone plans, but also give the opportunity to integrate it into other policies, such as for aging, such as for NCDs or mental health, like you suggested. Because in many countries, dementia care does fall under the jurisdiction of mental health care. So there it is. In order to be feasible, we do need to find synergies and ways in which dementia can be integrated in the normal ways in which care is provided in a country. And the other point that you raised, I couldn't agree more. The lack of awareness and the stigma associated with dementia is huge, and it's not just huge at population level, but it's also concerning, we also find that stigma and lack of awareness in policymakers and even in healthcare professionals. So and this is why awareness raising campaigns and initiatives such as World Alzheimer's Month that we're now in are so important in getting the message across that dementia is not an inevitable normal part of aging. There's a lot that can be done, but we do need to prepare our health and social care systems to be better prepared for the increase in numbers of people that will come.
Thank you, Dr. Dewar. Taryn, have you got anything you'd like to add? That's a shaking head. Okay, we have come to the last of the questions, last of the hands up. And I just want to thank you so much, Elmer and team from UNTV, for a great press conference, and of course to our expert speakers. The embargo lifts at 12 midday. You will be able to get the audio visual, and I think maybe the tape, certainly the audio, I'm not sure about the visual, that will be available shortly soon as well. I just wanted to ask our speakers if there are any last points they'd like to re-emphasize, anything else you'd like to add before we close. That's a shake of the hand from Katrine. What about Taryn?
Yeah, no, thank you very much for these questions. Margaret, there was something in the chat, somebody wanting to asking for the floor. I don't know.
This is something I missed that in the chat because Jan has dropped off several times, so I don't know if he's having trouble. Jan, let me. Oh, there is something in the chat. I see. Jan. Okay, yes, Jan. Please go ahead. I'm sorry. You keep dropping off, but go ahead. Can we hear you? Jan, we could possibly do a call with him later if that works. That would be fine. We've got our two great speakers have made themselves hugely available, so we can do one-on-ones, yes? Yes. Okay, Jan, sorry. We can't hear you, so yes. We'll close now. I think that's just a technical problem. And as I said, we've got, as you know, you can see, you've got a wealth of knowledge, information, brain power here in our two speakers, and they are very generously providing that to the world. So thank you all very much, and see you next time. Bye.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.